Hi, my name is Hayden Pritchett, and today I'm going to be doing my medication administration checkup. I'm a nursing student at the University of South Alabama. Here is my badge, and here is the room that I'm in. Okay, so the first thing I'm going to do is I'm going to make sure that I'm in a no interruption zone, that my door is closed, that I don't have any colleagues associated with me, and that I'm not taking any phone calls during this time to make sure my medication administration is correct. So the first thing I'm going to do is I'm going to compare my medication administration record, to my patient chart. So my patient is Jaguar J. Jones. Date of birth 8/25/1963. Date of birth 8/25/1963. Medical record number 4176352. 4176352. I see he's allergic to penicillin. It's penicillin. Okay, so the MAR calls for morphine sulfate, and I see morphine sulfate, 5 milligrams at 5 milligrams. IM, which is also intramuscular, every 4 hours, PRN pain, and PRN pain. Okay, that's correct. So now that I have compared my MAR to my patient's chart, I can put my patient's chart away. So then I'm going to do some hand hygiene, and I'm going to get everything rolling. So I'm going to make sure my patient is correct, Jaguar J. Jones. And the first thing I'm going to look for is the morphine sulfate. And I have my vials here, and I'm going to pick my morphine sulfate, which expires 12/20/2025. So it is good to use. There's my morphine sulfate if it wants to focus. There it is. Okay, so now I've selected that. I'll put my other medications over here. I'll not be needing those right now. And so the morphine's correct. So it's going to be at 5 milligrams. And my dosage is 10 milligrams per 1 milliliter. And since it's an intramuscular shot, I'll be using my 3 milliliter syringe. So to calculate that dosage, since it is 10 milligrams per 1 milliliter, it will be a half milliliter shot for 5 milligrams. And also to go along with that intramuscular shot, I will be using my 23 gauge and 1 inch needle. And I'll also be using my blunt cannula to withdraw the medication. So now I will check that it's every 4 hours, which is correct. My patient has not had a shot since his last dose, the previous 4 hours. And it is for pain, and my patient is complaining of pain. So everything checks out. So now I'm going to do hand hygiene, and I'm going to get everything rolling with the shots. Okay, so the first thing I'm going to do is I'm going to open my alcohol pad after I did hand hygiene. And then I'm going to clean the top of this vial, but I'm also going to leave it there so that way it does not get contaminated. I'm going to open my syringe, and I'm going to grab my cannula, and I'm going to screw that in. Let me get rid of that. So now that I have this, first I'm going to aspirate for 1/2 milliliter. So that way it is the same amount of the dose. And I'm going to take this off. I'm going to stick it in there. I'm going to aspirate. Okay. And now I'm going to flip it over. And I'm going to pull it to 1/2 milliliter, which is equal to 5 milligrams. And I'm going to get that air bubble out. And I can pull past 1/2 to get that air bubble out. Let's see. And then once I've gotten it out, I can push back to 1/2. So now that I have my dose, see if you can see that. It is 1/2 of a milliliter, which is equal to 5 milligrams. Sorry, it's trying to focus, but so now I'm going to scoop this back up so I can set that down. And I'm going to grab my 23 gauge needle. I'm going to get rid of this cannula now in my sharps container, and I'm going to put this on here now. So now my syringe is ready to go. So I'm going to go through and check this again. So my patient is Jaguar J. Jones, and he is receiving morphine sulfate at 5 milligrams. And I have my morphine and my sulfate right here. I'm comparing them to the MAR. So yes, I have morphine, and it's at 5 milligrams, and the calculations are correct because it's 10 milligrams per 1 milliliter. Since this is a 3 milliliter syringe, it is a half milliliter. And it is an intramuscular shot, and this is the best syringe for an intramuscular shot. And it's given every 4 hours, and it is about that time again, and it is given for pain, and my patient is complaining of pain. So it all checks out. So now what I'm going to do before I go into my patient's room, I have a label for my medication. So that way I know that it is correct, and I know that it is all set. Okay, so I can get rid of that. So now I'm going to get my syringe, my vial, and my MAR, and I'm going to go into my patient's room. So when I get into my patient's room, hello, Mr. Jones. I'm your nurse, Hayden, today, and I'm here to give you some medication. Is that all right? And hopefully I would say yes. And then I would first I would do hand hygiene, and then I would raise the bed to working height and lower a bed rail, and I would position my patient so that I could see. But before I position my patient, I will make sure that it is the correct patient. So I'll check and make sure. So it's Jaguar J. Jones, Jaguar J. Jones. Date of birth, 8/25/1963, 8/25/1963. Medical record number, 4176352, 4176352. Okay, and I see he's allergic to penicillin. I see you're allergic to penicillin. Are there any other allergies that I need to know about? No? Okay. So before I give you your morphine, I would typically ask for your respiratory rate and your BP. Or your blood pressure, I'm sorry. And so now that we have confirmed it's you, and I would take your respiratory rate and your blood pressure, I'm gonna check and make sure. So I have my morphine sulfate, and I have my syringe labeled with morphine. So that is correct. And then I have my 5 milligrams, which equals out to 1/2 milliliter. I have my intramuscular syringe. It's given every 4 hours, it's the time, and it's for pain, and my patient is complaining of pain. So I know it is time to give him his shot. So now that I know I have all the rights, I'm going to put on my gloves. I'm going to put on my gloves. I'm going to put on my goggles. And I'm going to open an alcohol swab. Put that away. I'm going to clean the area, making sure there is no bruising, and I'm checking the area to make sure it's okay to use. And we will be doing this on the ventrogluteal site because that is the ideal spot for IM shots. So now, after I know it's clean and I've cleaned the area, I'm going to take my lid off, and I'm going to hold that skin real tight, and I'm going to shoot it in, and I'm going to aspirate. No blood, and now I'm going to push it. Okay, now it's done. I can dispose of my sharps container, and I'm holding a little bit of pressure. I would stand here to make sure that my patient was not having an allergic reaction. And then after that, I would reposition him into a comfortable position, and I would lift the side rail, and I would lower the bed back to normal height. And then I would go back to my station, and I would document the 7 rights, the medication, the date and the time that it was administered. And I would also know if there were any allergic reactions. And then I will come back in 30 minutes to reassess if there are any allergic reactions, or any other complications.